Most people hear, your cat is just getting old, and they accept it. Slower movement, more hiding, less patience, maybe even a bit of aggression. It feels normal. It feels expected. But here's the problem. A cat's personality does not change overnight just because of age. A loving cat does not suddenly become distant for no reason. A calm cat does not wake up one day and start snapping, avoiding touch, or acting withdrawn without something driving that change. Aging is gradual. It's slow. It does not explain sharp shifts in behavior. So when you notice your cat acting different, that is not something to brush off. That is a signal. And one of the most ignored causes of that signal is something most owners never even think to check: their cat's mouth. Because hidden dental pain doesn't just affect eating, it affects mood. It affects trust. It affects how your cat reacts to you and their environment. And the scariest part is, it can look exactly like just getting old. If you've been telling yourself this is normal, you're not alone. Almost every cat owner thinks the same thing at first. But what you're about to learn might completely change how you see your cat's behavior and what it's really trying to tell you. Cats are masters at hiding pain. It's part of their survival instinct. In the wild, showing weakness makes them a target. So even when they're hurting, they act normal. Or as close to normal as they can. That's why dental pain is so easy to miss. It doesn't always look dramatic. There's no loud crying, no obvious limp. Instead, the signs are quiet. Small changes that build over time. And here's one of the biggest myths that tricks people. My cat is still eating, so they must be fine. That sounds logical. But it's not true. Cats will keep eating even when their mouth hurts. They have to. It's survival. They just adjust how they eat. Maybe they chew on one side. Maybe they eat slower. Maybe they drop food and pick it up again. You might also notice your cat grooming less, or choosing to rest more instead of moving around. Maybe they seem a bit more distant. Not as social. Not as playful. These don't feel like dental problems. They feel like aging. That's why they get missed. So it's not that the signs aren't there. It's that they're easy to explain away. And while everything looks mostly normal on the outside, your cat could be dealing with constant discomfort inside their mouth. Let's make this real for a moment. Think about your cat right now. Not how they were a year ago. Not how you remember them. Right now, has your cat started hiding more than usual? Maybe choosing quiet spots where they don't get disturbed? Have they become a bit more irritable, especially when you touch around their head or face? Even small reactions matter. Look at their grooming. Is their coat not as clean or smooth as it used to be? Cats take pride in grooming. When that drops, something is often wrong. What about their energy? Are they less playful? Less interested in things they used to enjoy? And here's a big one. Have you noticed any changes in how they eat? Slower eating. Dropping food. Turning away from harder food. Even if they still finish their meals, the way they eat can tell you a lot. If you're seeing even one or two of these signs, don't ignore it. It doesn't confirm anything yet. But it does mean you should pay attention to what comes next, because these small changes can connect to something much bigger happening under the surface. Let's start with one of the most common issues. The plaque and tartar buildup. It sounds harmless. It sounds like a small hygiene problem, but over time, this hard layer forms on your cat's teeth and starts to irritate the gums. At first, the pain is mild. Easy to miss. Your cat may just seem a little less patient. Maybe they pull away slightly when touched near the mouth. Nothing dramatic. That's why it often gets ignored. Now it progresses to gingivitis. This is where the gums become red, swollen, and sore. Eating starts to feel uncomfortable. Your cat may not show it clearly, but you might notice they hesitate before eating, or they don't enjoy it the same way. Behavior starts to shift. Less interaction. More quiet time alone. Comes advanced periodontal disease. This is deeper. The infection moves below the gum line. It affects the tissue that holds the teeth in place. At this stage, the discomfort is constant, not just when eating. Your cat may become withdrawn, sleep more, avoid contact. It's not just physical anymore, it affects their whole mood. Now here's something many owners have never heard of. Tooth resorption. This is one of the most painful dental conditions in cats. The tooth starts to break down from the inside, slowly, silently, and from the outside, it can look completely normal. No obvious damage, but inside it's extremely painful. Cats with this condition often show sudden behavior changes, irritation, sensitivity, even avoiding food they used to love. And finally, oral infections and abscesses. This is the most severe. Infection builds deep in the mouth. Sometimes there's swelling, sometimes there isn't, but the pain can be intense. This is when you may see major personality shifts. A normally gentle cat may become aggressive or completely shut down, not because they've changed, but because they're trying to cope. Each of these issues builds on the last, and all of them can be present without clear warning signs. That's what makes them so dangerous. They don't just affect your cat's teeth. They slowly change how your cat feels, acts, and connects with you. Now let's clear up a few beliefs that cause people to miss these problems. First, my cat eats fine, so nothing is wrong. This is one of the biggest mistakes. Cats will keep eating even when they're in pain. They don't stop unless it becomes extreme. Instead, they adjust. They eat slower. They chew differently. They push through it. So eating does not mean comfortable. Second, bad breath is the main sign. Not always. Some cats with serious dental issues don't have strong bad breath at all. And some cats with bad breath don't have severe disease. So smell alone is not a reliable signal. Third, my vet would have already noticed. In many cases, yes. But early dental problems can be easy to miss without a close exam, and sometimes even x-rays, especially if your cat doesn't show obvious signs. That's why these issues can stay hidden for a long time. And here's the truth most people don't hear. Many of these problems start small and stay quiet. They don't show clear warning signs until they've already progressed. That's why relying on obvious symptoms can give a false sense of safety. So if you've believed any of these before, it doesn't mean you did something wrong. It just means you were working with incomplete information. And now you're starting to see the full picture. This is the part where a lot of people start to worry. They think, if my cat has been dealing with this for a while, have I waited too long? In most cases, no. Many dental issues in senior cats can be treated. And when they are, the change can be surprising. Cats that seem distant often become more social again. Cats that were irritable become calmer. You're not just fixing teeth. You're removing constant discomfort that was affecting their whole behavior. Now, it's true that treatment may involve a professional cleaning or dental work. And yes, for senior cats, people often worry about anesthesia. That concern is completely normal. But vets take age into account. They run checks. They adjust care to keep things as safe as possible. The bigger risk, in many cases, is leaving the problem untreated. Ongoing pain, infection, stress that slowly wears your cat down over time. So this isn't about panic. It's about timing. The sooner you catch these issues, the easier it is to manage them, and the better your cat can feel again. So what should you do from here? Start simple. Pay close attention to your cat over the next few days. Watch how they eat. Watch how they groom. Notice where they spend their time. You're not looking for one big sign. You're looking for small patterns that feel off. If your cat allows it, you can gently look at their mouth. Don't force it. Just a quick calm check. Look for red gums, buildup on the teeth, or anything unusual. Even a small reaction when you get near their mouth can tell you something. But the most important step is this. Don't guess. If something feels off, schedule a vet visit. Ask specifically about their dental health. A proper exam can reveal what you can't see at home. In some cases, your vet may suggest dental x-rays to check below the surface, where many hidden problems live. Taking action early makes a huge difference. It can prevent more serious issues. It can reduce pain, and it can help your cat return to the behavior you know and love. Your cat isn't being difficult. They're not just getting old and losing their personality. In many cases, they're trying to cope with something they can't explain. When a cat pulls away, hides more, or reacts differently, it's easy to take it at face value. But behavior is often a message. And sometimes that message is pain. The hard part is, they won't show it in obvious ways. They won't cry out or make it clear. They rely on you to notice the small changes, the quiet signals. The good news is, once you understand what to look for, everything starts to make more sense. And more importantly, you can do something about it. Because when the cause is found and treated, many cats don't just feel better. They act like themselves again, more relaxed, more social, more comfortable. So if something has felt off, trust that instinct. Look a little closer. Take that next step. Because the sooner you catch it, the sooner your cat can feel like themselves again.